Okay, good afternoon. My name is Andrew. So today we're going to look at the first part of DME, communication skills actually. So the first part we're going to look at is what communication is. So communication is the first part that we're going to look at, and I'm using this is JM Shaker's notes. Okay, so let's get to it. So the outline is going to be, we're going to look at the process, models and types of communication skills. We're going to look at the principles of communication. We are also going to look at facilitating communication, barriers to effective communication, transcultural communication, interpersonal relationships, and therapeutic communication. So let's get to it. So the first part we're going to look at is the definition of what communication is. So the first part is communication is a way of conveying, imparting, or exchanging ideas. So you convey, you impart, and you exchange your ideas. Now communication is imparting or exchanging of information by speaking, writing, or using some other medium. So you can either write it down, you can either speak it out, you can use any other medium. So even writing it down is a part of communication. Like the way these notes are were written down, these notes are communicating to us about what communication is actually. Okay, so we're going to look at therapeutic communication as a second thing. So what is therapeutic communication? So it is communication directed from the patient towards the patient to identify his current healthy problems, the plan and the implement and evaluation of the action to take. So basically this is the type of communication. I want you to pay attention to this term that is being used here. This term, therapeutic. So therapeutic is coming from the term therapy, so to say. And you know that when we talk about therapy, it's more of talking to someone, trying to understand what they're passing through. So when we talk about therapeutic communication, we're talking about a specific type of communication where a patient is having a conversation with a medical health personnel to help him or her know about their current health problems and the plans in which they can implement and evaluate on the action they should take to help the patient out. So it actually helps to develop a mutual understanding between two individuals, and it also helps to give a learning sensation or a learning experience for both the patient and the healthy worker. Now let's look at some of the characteristics of therapeutic communication. One of them is empathy from other people's pronunciations, so to say. So when we talk about empathy, it is more of understanding the patients on their own terms. Like you put yourself in the condition where the patients are. So do you discover the patient's felt meaning of their experience? What are they passing through actually? So you put yourself in their shoes, so to say. Then you understand them according to the way they are. You do not make assumptions of what they are feeling. So we're going to look at the other characteristic of therapeutic communication, and that is unconditional positive regard. So this is a part where you do not judge them. It acts like a non-judgmental acceptance to what they're actually feeling. You do not try to control clients to meet their own needs, but you accept the uniqueness of the patient. You understand them. You do not judge them, then you understand and accept their uniqueness. So it is called unconditional positive regard. You are unconditionally accepting who they are as a patient. Then the other characteristic we're going to look at is congruency or genuineness, so to say. It's a condition where we talk about the openness, the honesty, the sincerity, the active involvement, and the accepting the patient's uniqueness is also found in congruency and genuineness. You honestly talk to them, you sincerely talk to them, you come out openly as a medical practitioner. The other part is the warmth aspect of or characteristic. This results from the flaws that you naturally show from the skill of empathy. It is mostly expressed non-verbally. You give them that tone of voice that is give them so that they can have a warmth discussion with you, a warmth therapeutic discussion with you. You give them that caring touch. You do not judge them by acting with positive regard. You give them the posture that they think or they feel you are actually understanding them on their basis. You are not actually judging them. So the last thing we're going to look at today is the respect. The respect. So how do you show respect? It's by caring, concern, liking, and maintaining confidentiality, confidentiality actually, and active listening. We're dealing about active listening, so yeah. So basically, those are some of the characteristics of therapeutic communication we are going to look at today. Thank you very much. We're going to end the video for me. Then next time we're going to meet, we're going to look at transcultural communication.